Hello, welcome to my YouTube channel. So today we are going to learn the liver. Liver is the largest gland in the body which occupies most of the right upper half of the abdominal cavity. It weighs about 1.5 kilogram and responsible for 2.5% of the total body weight. The liver almost occupies the right hypochondrium, epigastrium and the left hypochondrium. Inferior border presents two notches. One notch is here, that is on a cystic notch where the fundus of gallbladder is related, and there is another notch for the ligamentum teres. This is the ligamentum teres over here, and this is the notch for ligamentum teres. Okay, that is the inferior border. Now, then coming to the posterior surface. Okay, so here we have the posterior surface where an important structure is related, that is the inferior vena cava. So here we have the inferior vena cava. Inferior vena cava is present here. Okay, now the visceral surface is related to, we have the inferior vena cava here, there is a gallbladder and there is another structure called porta hepatis. We will come to that later. Okay, on the inferior aspect, what are the structures we can see? There is a fossa for gallbladder, fissure for ligamentum teres, there is a ligamentum teres here, fissure for ligamentum teres, and there is a porta hepatis. I already told you there are two anatomical lobes, there is a right lobe and left lobe. On the diaphragmatic surface, the right and left lobe is divided by this structure. What is the structure? That is a falciform ligament. But on the visceral surface, the whole is a visceral surface we are seeing, the liver is divided into four lobes. So what are the structures present on the visceral surface of the liver? We have the inferior vena cava, then there is the caudate lobe, there is a right lobe, then there is a quadrate lobe, there comes a porta hepatis. Porta hepatis is the gateway to the liver, or the hilum of the liver is known as a porta hepatis. Okay, here we have the gallbladder. Okay, and this is a fossa for gallbladder, and this area, this deep fissure, this is ligamentum venosum, and this is the fissure for ligamentum venosum. Now, these are the anatomical lobes of liver. Okay, so I have already uploaded a video on its physiological lobes of liver, that is the hepatic segments. Okay, if you did not watch the video, please go and watch the video. You know the liver is covered by peritoneum. Okay, and now we are going to see the peritoneal reflections onto the liver. So here we have the anterior surface of liver. So here we have this structure, this is known as the falciform ligament. It has got two borders, anterior border, posterior border, two surfaces, right surface and left surface. Okay, onto its posterior there is the ligamentum teres. Here we have the ligamentum teres here. Okay, then so this falciform ligament is connecting the anterior surface of the liver to the posterior aspect of the anterior abdominal wall. Okay, this falciform ligament or the parietal peritoneum getting reflected from the body wall to the liver. Okay, it is getting reflected from the diaphragm to the liver. Okay, and this ligament is known as a coronary ligament. Why it is called coronary ligament? The ligament is present on the superior surface of the liver, okay, corona means crown. Crown is on the head. Okay, so this particular ligament present, or it is attached to the superior surface of the liver, that is known as a coronary ligament. Okay, I told you coronary ligament has got two layers are there, the superior layer and here we have inferior layer. Okay, so the superior layer, it is getting reflected from the diaphragm to the superior aspect of the liver. Okay, again from this aspect of the liver, the peritoneum get reflected onto the kidney posteriorly, and that forms the inferior layer of coronary ligament. So we have superior layer of coronary ligament here and inferior layer of coronary ligament. Okay, there is an area of the liver which is present between the superior layer and the inferior layer. Okay, so that particular area is known as the bare area of liver. That means the liver in this part does not have any peritoneal attachment. Okay, then the superior and inferior layer of this coronal ligament, which is going to the right side and fuses to form the right triangular ligament. So here it forms the right triangular ligament. So here we have the right lobe, left lobe, and this is the caudate lobe, and here we have the quadrate lobe. Here the caudate lobe and quadrate lobe. You know, the caudate lobe is connected to the right lobe by caudate process, okay, and here we have the quadrate lobe. Let us see the boundaries of caudate lobe. You know, this caudate lobe, it is on the right side, it is the fissure for inferior vena cava. On the left side, it is bounded by the fissure for ligamentum venosum, and superiorly, if you see superiorly, this particular structure, that is a caudate lobe, it is continuous with the superior surface, and inferiorly it is bounded by this deep fissure is known as the porta hepatis, inferiorly porta hepatis. Then let us see the boundaries of quadrate lobe. So this is a quadrate lobe, okay. Quadrate lobe, it is onto the right side, there is a fossa for gallbladder. Left side, there the fissure for ligamentum teres. This is the ligamentum teres, fissure for ligamentum teres, superiorly bounded by the porta hepatis, and anteriorly inferior border of the liver, okay. That is the boundaries of quadrate lobe and caudate lobe. Now, let us see the ligament. I told you there is the superiorly we have the coronal ligament. Coronal ligament has got two layers, superior layer and inferior layer. Superior layer is getting reflected from the diaphragm, and from the liver the posterior layer reflected onto the kidney. If you trace this superior layer and inferior layer to the right side, what happened, these two layers fuses to form the right triangular ligament. Here we get the right triangular ligament attached to the diaphragm, okay. And if you trace this superior layer of this coronal ligament towards the left side, fuses with the right part of the falciform ligament. Anteriorly we have the falciform ligament, okay, falciform ligament. And if you trace this inferior layer of the coronal ligament, if you trace towards the right side, inferior layer of coronal ligament merges with the right part of the caudate lobe, okay. Just like the right triangular ligament, here we have the left triangular ligament. Left triangular ligament attaches to the diaphragm. There is another peritoneal relations from the porta hepatis to the stomach, that is the lesser omentum. So lesser omentum is attached to the, it has got that attachment is somewhat like this, okay. There is the J-shaped attachment of the lesser omentum, okay. It has got a vertical limb and horizontal limb, okay, and the vertical limb of the lesser omentum is attached to the fissure for ligamentum venosum, and the horizontal limb is attached to the margin of the porta hepatis. The fissure is known as the porta hepatis, margin of the porta hepatis. The ligaments of liver are divided into false ligaments and true ligaments. Okay. So false ligaments are, we have the falciform ligament anteriorly, then this coronal ligament, right and left triangular ligament. So these are the false ligaments, and the true ligaments are, we have the ligamentum teres, and here we have the ligamentum venosum. So ligamentum teres is the obliterated umbilical vein, whereas this ligamentum venosum is the obliterated ductus venosus. Okay, remember these points. Now let us see the visceral relations of liver. Okay, now you know liver is placed just below the diaphragm, okay, onto the left lobe of the liver. Here is a right lobe and this is a left lobe, okay. On the left lobe of the liver, immediately left of the fissure for ligamentum venosum, there is a small depression that is for the esophagus. So here we have the esophageal impression. You know, esophagus continues as stomach, okay. Most part of the left lobe is related to the stomach, both cardiac end and fundus of stomach. We have the cardiac end of the stomach is related. Here comes the fundus of stomach is related. Okay, cardiac and fundus of the stomach. Okay, and here we have the quadrate lobe. is the quadrate lobe. Okay, area behind the quadrate lobe is related to the pyloric part of the stomach. Pyloric part of the stomach, and pyloric part of the stomach continues as a duodenum. Okay, so here is the duodenal area. Then first and second part of the duodenum. First and second part of the duodenum is related onto the visceral surface of the right lobe of the liver, right of upper part of the gallbladder. First and second part of the duodenum is related onto this area. Where exactly? On the visceral surface of the right lobe of the liver. Okay, right of the proximal part of gallbladder. Okay, now again, just right of fundus of gallbladder. This is a fundus of gallbladder. Right of the fundus of gallbladder, here is the colic area. That is the colic flexure or the hepatic flexure colon is related onto this area. Here is a colic area. Okay, flexure of colon is related, and just posterior to it, just posterior to this colic impression, here we have the impression of kidney. Right kidney is related and right suprarenal gland, and this is the bare area. You know, bare area of the liver means the areas devoid of peritoneum. So how will you describe the bare area? So there is a large area on the postero-superior aspect of the right lobe of the liver, which is bounded above by the superior layer of the coronal ligament, inferiorly by the inferior layer of coronal ligament. Okay, another is the fossa for gallbladder. Here we have the gallbladder, and this fossa is also not covered by peritoneum, and there is a fissure for inferior vena cava. Okay, so here is also there is no peritoneal attachment. Now let us see porta hepatis. I told you porta hepatis is a deep transverse fissure which is bound in front by the quadrate lobe and behind by the caudate lobe. Okay, deep transverse fissure which is present between the quadrate lobe and the caudate lobe, that is known as the porta hepatis. Deep transverse fissure. Okay, and three structures are processed through the porta hepatis. We have the portal vein, hepatic artery and bile duct.